You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, natural results, looking your best at any age with board-certified plastic surgeon, Dr. Shatkin. Dr. Shatkin, welcome to the program.
Great to be here.
Good. Now, before we get into today's topic, for people that don't know your center, what are the different services you offer, and what are the different procedures you do?
Well, we do a lot of different procedures. You know, as a board-certified plastic surgeon, essentially we work head to toe. And a lot of times I like to tell people that I'm more of an anti-gravity doctor because in many senses that's what we do as plastic surgeons. Okay. But our goal really is to just make people feel better about themselves, try to turn the clock back, and try to regain some of that look that they might have had years past.
Okay, and we're going to talk a little bit about facelifting today. Also, you brought some photos. I'll give you time to show that. But you know, we were talking on the phone, and your father, by the way, worked within your practice. But you said he'd be proud of you today with what you're able to do. That means the results today, you said, are better. Why? When
I do this, I'm really taking a three-tier approach to these patients. I'm looking at the quality of their skin. I want to see what's going on the surface. I'm looking at the structures that are holding up that skin. And of course, we're looking at the sagging and the changes that happen with gravity. And I think because of all that, we're accomplishing much more for the patient.
So you have all the new technology as far as non-invasive facial rejuvenation?
We have all that technology. And the nice thing about it is it provides a change to the patient's appearance that you can't just get with surgery. The nice thing is we need to work on that surface. If we can work on the surface and put a new platform for people to see on the outside, I think it makes a world of difference on how people perceive themselves. So I think that's really important. So these new technologies do that, where surgery alone can't help that.
Now let's move right into today's topic. We're talking about facial rejuvenation. Okay, a woman in her 40s. And by the way, are the patients getting older and older that are coming in, or are they getting younger and younger that are coming in?
Well, they get younger and younger after we're treating them.
Okay.
But, you know, it's interesting because we really have various tiers. And when we're talking about facial rejuvenation, I really like to focus on those patients that come in the 30s and the 20s, 30s, and 40s, because I can be proactive. I can try to, you know, help them in the beginning using things like Botox and fillers and maybe taking away spider veins from their skin and some of the brown spots that they developed from some sun exposure. And if I can start them early, then I can maybe fend off the need for those surgical procedures, which will probably come in time with gravity.
Okay, okay. So the 40s. Let's talk about the surgical patient. They come in, what do they want to know? I mean, what do they say? What bothers them? And also I'd like to know, as a plastic surgeon, like what's going through your mind?
Right, you know, I have patients that come in and say, Dr. Shatkin, what do you think? And you know, it's okay for them to do that because they come to me as the expert, and I like to you know, have that opportunity to tell them. But I turn it back on them and say, you know, what is it that bothers you? What do you see when you look in the mirror that you're not happy with? Okay, and I want to know that. Once I know that, then I can customize something exactly right for them. So
what do they typically say, by the way? Let's say late 40s, early 50s.
Right,
what
late 40s. A lot of these women and some men come in and just say, you know what, I feel tired. I look in the mirror and I don't feel the same way on the inside that I do in the mirror. I just think that I'm more tired when I see myself in the mirror. And they don't feel that way. You know, a lot of them are exercising, they're bike riding, they're doing activities. So that's what they come in for. And that's a very typical, you know, complaint that they have. Many times it's the fine lines around the eyes. Easy. We can do some lasers, we can do some Botox, help them very easily. And sometimes it's those simple procedures that turn back such subtle changes that make the dramatic change in the way they feel and their outlook towards life. And if I can do that for them, I'm happy.
You could take a 50-year-old, make them look 40?
Oh, yeah.
Late 30s, all the time?
Oh yeah, very, very common thing, you know, because sometimes it's very subtle what needs to be done. A little filler around the mouth, maybe a little Botox here, just to relax them. Not everybody has to be a plastic surgery, surgical procedure. Sometimes we'll do these non-surgical methods to rejuvenate before we need one day the more surgical procedure.
Are there people that ever come in, because of the internet, you know, they self-diagnose and they feel like they know exactly what they need? You ever have to talk them out of it?
Well, Randy,
like
you know what?
Surgical procedure?
You know what? I always, Randy, will talk to them about what I think would be best for them. And a lot of times they'll bring up, say, well, you know, my friend so-and-so had this, or I saw in an infomercial this. You know, I need to pick out what procedure is best for them. And honestly, I've been in practice 25 years. I know the various new procedures that come out. I'm not one to start on a bandwagon. I wait and see until the techniques are tried and true. And then I'll add those to my armamentarium. And when I reach that approach, then I know I'm offering the patient the very best whether it be with my own surgical hands or with the techniques, with the machines that we use, the lasers, the microneedling, the microdermabrasion, the chemical peels, all of these various tools that we have. And I know they're going to get the result they want.
Okay, let's start with the eyes. What are you doing for the eyes? Tired eyes.
Well,
bags under the eyes.
Oh yeah, we have patients that come in all the time with bags under the eyes, and that's their biggest complaint. You know, they're saying that my fellow employees, they tell me I look tired, and you know, I don't feel tired. I feel great. What do I do about it? And it could be somebody in the age of 30s all the way up into 60s and 70s. It doesn't have to be just an older individual. So we very often will do a blepharoplasty, an eye lift. Sometimes we'll add that skin tightening with a little laser resurfacing to get the crepiness, which you can't always get just with the surgery, you know, which is interesting. And I mentioned earlier when you were interviewing me before that it's not just the surgical procedures of tightening. We need to look at the surface. We need to look at the structures below the surface and what we need to do to make them rejuvenated.
Now, do you think that if you're going to get, I'm just curious if you have a bias here, that if you're going to go in for an evaluation of what needs to be done and you're in your late 40s or 50s, should you go to somebody that does both? Like somebody that's a plastic surgeon but also has all the technology, lasers, IPL, etc.?
Well, you know, I once heard the comment that if all you have is a hammer, the whole world looks like a nail. And that technically means that if you only have one method to manage something, then typically you'll use that method over and over again, and sometimes you'll get the results you want if it's the right patient, the right problem, and sometimes you won't. So the nice thing about our practice, first of all, I've got a team of skincare specialists. I've got a PA, a nurse. I've got 5 estheticians that work in my office and a cosmetologist. So they can help with the skincare management. But then if they do need the surgery, then I can help them with that. So we have that whole team approach to getting them the best results.
Let's talk about brows and eye, above the eye. So we talk about under the eye. What about?
You know, I'm not a strong proponent of doing really tightening of the brows. You know, the brows are meant to be in a certain position. And I show a picture of celebrities like Leonardo DiCaprio, for example, who's got a heavier brow. He's very youthful looking. Why do you need to pull that thing back up? But I think a lot of people come in and they don't like the smoothness of their forehead, and they need a little bit of tightening. On many of those individuals, we'll go ahead and do some laser resurfacing. I do the brow lift, I do the endoscopic approach for those that need it, but sometimes a little goes a long way. And we don't need to go.
You know, I don't want to put my opinion here, but it seems that the older the women, especially here in California, the brows are high. Young people don't have high brows.
Right, exactly. That's the point. So
right.
you want to rejuvenate them and make them look like a younger version of themselves, not something that's totally different, and not to take away, here we are in California, from that Hollywood facelift, because there are doctors that can overpull, and sometimes they're looking for that. But here in Buffalo, New York, that's not what we're trying to accomplish. It's a very conservative community, and people just want to look natural. I want my patients to be walking down the street, and if somebody sees them there, they look at them and say, wow, what a well-proportioned, a balanced, youthful person, you know, healthy-looking person. I don't want them to say, hey, who did that facelift?
But I feel like I could spot a facelift walking down the street.
Well, I can, but maybe in my practice you wouldn't be able to. I don't know.
Is that right? Is that the fear with women, and talking about surgery, like the modern facelift? People don't want to look done. Knowing that you were going to come on the show, ask my circle of friends, everybody's worried about looking done. Even my friends, their wives, they go, Randy, I don't want them to look done.
Right. Well, Randy,
does that come up?
Yeah, Randy, absolutely. I know where you're going with that. Many patients come to my office and they waited 4 or 5 years, and I'm thinking, why did you wait? Things bothered you before. Because they are afraid they're going to look pulled. Because they're afraid they're going to look unnatural. And once I show them some photos in our office, demonstrate to them what that natural look might look like, and then a lot of them say, well, gee, that's sort of like me. That's what I might have looked like 5 years ago.
So what are you doing? I mean, you're returning, there's 2 ways to go about this. And I don't want to put words in your mouth, but from talking to you, that there's pulling and then there's repositioning tissues to where they used to be.
Well, I look at
what are you doing?
Right. Well, I think what makes it different for me, and I think I've evolved this technique over many, many years, I look at the surface, I look at the supporting structures below the surface.
Like what?
Well, I look at what the quality of the skin is. If the skin is damaged, if it's got sun damage and spider veins and things like that, to rejuvenate them and get them good balance, I have to approach that.
So good skin.
Right. And then I look at, so the quality of the skin is important. The second thing I look at is the supporting structure of the skin. You know, once they get that jowly stuff
like
hanging
muscles
here,
and
muscles,
fat?
fascia, and the fat underneath the surface, because youthful people have a nice, beautiful roundness to their face. They have that fullness that really exudes youthfulness. Okay, so I want to bring that back to where it used to be. In order to accomplish that, I'll take those deeper tissues during my surgery and I'll just pull them back up. I'll re-support them inside.
Okay.
And that gives them that highlight, the cheekbones, the fullness that makes it look natural. And that's why when I go ahead and redrape the skin, it's not a tug and a pull. It's a gentle redraping of the skin back, and now they've got that youthful appearance and they're happy with it.
For face lifting and things like that, mostly women that are coming to you. Is that correct?
Well, it is mostly women.
Do they bring their partners in?
Very often they do.
Spouse, whatever?
I think it's great. I like that because not only do they need that support, but then the spouse, or it could be a male spouse, a female spouse, then they know what they might be going through because they're going to have to help them in the recovery if it is a surgical procedure. And I like that. It shows them that they're sort of a team too. And I have a wife that I love, and I think it's important to have a partner in life that you can confide in and help you through these things.
Okay, neck and jowls, what are you doing?
Oh, well, you know what?
That seems to go first, the eyes and then that lower part.
Some people come in just because of that turkey neck, and they're really bothered by that. And some of the individuals that come into my office, they look like they're heavy, and all I have to do, some of those, just do a little fat removal from underneath here, a little
like liposuction?
Liposuction, recontouring maybe on the surface with a laser treatment, and we can make them look like they lost 10 to 20 pounds with only taking out an ounce in the right spot. We can contour the jowls with that too. And it's especially useful for men because, as you know, men don't always want to undergo a big surgical procedure. They don't have the hair that might hide some of the scars from around the ears. So we can do these procedures with a small incision here. And these men can be totally changed and rejuvenated with a minimal incision and minimal recovery. And the men like that too. So both for men and women, it's a great procedure.
These national infomercials on like low downtime facelifts.
Right.
What are your thoughts on that?
Well, there are procedures low downtime, and I offer that. I have this thing that I call the S-lift for Shatkin, okay, or I also refer to it as a short recovery facelift. And I like that because for those individuals that are fairly young, maybe in their 30s, 40s, or early 50s, they might be a great candidate for this procedure. And the reason they might be good candidates is because they don't have a lot of that hanging loose skin. They just want a refreshing. And I think those are great candidates for this mini facelift. So you might see something on an infomercial or on TV. These techniques have been around for decades, really. I've been doing them for 25 years. So there's nothing really new to the plastic surgery field. But now we're deciding which patients might benefit from that. And some of them don't. And sometimes these patients come in for these mini facelifts, and I have to explain to them, Mrs. Smith, this is not for you, but let me suggest something else. It'll give you harmony and balance and beauty to your face. We need a little bit more. So it really depends on the individual, and as I said before, we customize that.
So the women on the console, do they want to look prettier? Do they want to look great for their age? Do they want to look rested? What do they tell you? Well, I asked you earlier, but I'm just curious.
Right. Well, I think it's a combination of all that, but they always tell me they want to look natural, they want to look balanced, and they want that rejuvenation that brings them back, turns the clock back. They don't want to look like somebody different, and that was the patient that waited 4 or 5 years to come in to see me because they're nervous about that. They want to just look refreshed and rejuvenated.
Your brother, who we've had on the show, he's also a doctor, says that you are known for the guy, they go to you because you get the people that don't want to look different, they want natural results. You're known as a natural result guy. Do you feel that way?
Well, I'd like to be known like that. And I think it really, it tells a story about what my brother and I both do in the office. Natural look. Our father sort of, told us that, you need to take care of the patient. You're not always caring for the patient. You care about the patient. You care about what they want and what they need and what would be best for their life.
Dr. Samuel Shatkin of the Aesthetic Associates Center, offering unsurpassed plastic surgery and skincare services. Dr. Sam Shatkin's one-of-a-kind facility is equipped to handle both surgical and non-surgical procedures, offering rejuvenation without lengthy recovery periods. Located on the corner of Main Street and Kensington Avenue. www.greatlook.com. Unsurpassed service for an unsurpassed look.
So when should somebody consider surgery or consider a procedure?
Well, when people start to see something that bothers them, okay, and very often they're looking in the mirror, and as I mentioned earlier, they just don't like what they see because it doesn't fit the way they feel on the inside. That's when they should come to see us. And we have so many different tools to do it. But I can tell you a story, Randy. There's a patient that came in, a male patient that just didn't like the crepiness and the crinkling around his eyes and the puffy bags there. And he just said, you know, I'm in my 30s. I don't need to look like this, but everybody thinks I'm much older. Everybody's talking to me about why am I tired all the time, like they thought I was partying at night. And, you know, we know this gentleman, he told me it was hereditary. He looked like his dad and his mom. They both had the puffiness in the back. So I said, look, this is the procedure I think we need to do. You know, he approached me and said, what do you recommend? So we did a blepharoplasty on him and a little bit of laser resurfacing.
So blepharoplasty is what?
A lower eye lift. That's all we had to do on this gentleman because that was the puffy bags. He felt like he was just looking too tired. So we did the blepharoplasty, did a little laser resurfacing on that, and when he recovered, and the recovery, by the way, for that is less than a week. I mean, it's not a long recovery. He couldn't believe the difference, and his friends couldn't believe the difference. They thought it took years away, and all we did was take not even an ounce of fat from below his eyes.
So you make a guy or a gal that looks tired, now she doesn't look tired.
Right, they don't look tired.
So you say that, and we talked a lot on the telephone, not a lot, I mean, we had a good conversation, but that if you don't like something about yourself, whether it's your nose or whatever, it can hold you back. Elaborate on that.
Well, Randy, you're right. It can hold you back. A lot of people are timid, they're introverted, they don't feel as confident as they might have used to be when they were younger. Maybe in the workplace, they're feeling intimidated by working with other colleagues that they may be a little older, but they're having that competition somewhat with the younger people that are there. If those things are bothering them, it's time to come in. If they're bothering them and they don't like that, you know, change that they're seeing, it's time. And those are the individuals we see a lot of. You know, we get people in our office that there's no typical patient, but we get school teachers, we get firefighters, we get business executives, we get people that are fighting to get back into the industry.
So just regular people are coming in now.
You know, our regular patient is a regular individual. You know, and Western New York, Buffalo area, it's sort of a blue collar kind of town. But everybody's the same anywhere you go. They all want to feel the best they can and look the best they can. And those are the type of clients we get coming.
So what are some of the older clients?
Well,
patients?
You know, Randy, I got a good story about that as well. You know, I get people all the time, and now they're retired, they're playing cards with their girlfriends, and you know, they're sitting across from each other, and they don't like that tired look. They
like 70s, 80s?
70s, 80s. I've done facelifts well into the 80s on these individuals. You know, there's no chronologic age that determines when you're ready for surgery. There's two things, I think.
Okay.
One thing is, do you feel like you want it or need it, and another thing is your overall health. So I could take somebody in their 80s, if they're generally healthy and they say, okay, it's time for me to do something, we'll do surgery on them. And many times, though, when they get to that age, it's not a simple procedure. You know, it's not that mini facelift. They need a little bit more.
Okay.
And again, we'll go back to those three parts of the skin that we're going to treat. We're going to treat the surface, we're going to treat the supporting structures, you know, which I do on every individual. I'm addressing that, I'm assessing that. And then we're going to do some of that skin tightening. And a 70 or 80-year-old will need a little bit more than the
Can they look in their 50s?
You know, I don't want them to look in their 50s because, you know, then it would be
do you hear stories from like the spouse or somebody say, she looks 20 years younger?
You know what the stories I hear, Randy?
Yeah.
The things that I hear is that all of a sudden, you know, this friend of mine, or all of a sudden my spouse is more outgoing. They want to go out more. They want to be with their friends more. They are joining the gym. They feel better about themselves. Do social clubs, book clubs. You know, all of a sudden, the things that was holding them back before, and now is giving them that opportunity to really feel like they can get back into the world. And
so
that's
they become
a wonderful
more
story.
active, more engaging.
And more engaged, and I love that story. That's what gives me chills. I really feel great when I see that.
Are there tipping points, like where you know, their daughter's getting married, they're getting married, something's going on,
yeah, the
getting
reunions,
divorced?
you know, the college, the high school reunions, yeah, all the time. In fact, you know, just recently I had my own college reunion. I'll tell you, it's the 35th college reunion. And some of the individuals said, gee, I wish I had seen you a month ago, Sam, because I would have come in to see you. I didn't know you did that stuff, you know. But many people come in to see me, and they want to tweak things a little bit. You know, very often their son or daughter's getting married. They want to look refreshed. You know, if you're given enough time, we can do a facelift. If you're only given a month or so, we might do a little Botox, some fillers, refreshing of the skin. You know, we do, as I mentioned before, we do a lot of skin resurfacing, peels and lasers. We can do those things to freshen them up. But if they're going to give me time and they have certain things that are bothering them, I can help them get to that point.
Do you think you're an artist?
I like to think that I am, Randy. I've dabbled with sculpturing, and I think the reason that I've done that is because I need to see the three-dimensional form, and I use that approach when I see my patients. It's almost like a patient's commissioning me. If they come to my
like an
office,
artist, okay.
Yeah, I like to think so. I wouldn't say that I'm like a Michelangelo or anything, but I when they come into my office and they commission me to give them suggestions and to help them, I ask them, what is it that you're bothered by? And then I start to help them figure that out. Once we come to terms, then we go ahead and do the procedure, and they're happy.
Like any artwork, some guys are just better than others, right?
Well, I definitely would agree.
People call me and they'll say, Randy, who should I go to? And at the Wellness Hour, we don't give referrals, but we say, look at their work. You'll know them by their work.
Well, you know what? Our biggest
and make sure you get along with the doctor.
Right. Well, you know what? Our biggest referral is secondhand. It comes from other patients or families that had procedures done in our office or people that know us that way. And I think that's the best referral, because then they know your work, they know what you can do, and they've passed that story on to their friend or their family member, and they'll come in to see me. Okay. And we can help them with that.
I told you to bring one photo, so you brought a photo.
I brought 4 photos of one patient, 2 before, 2 after, and I think they're really depict, and they're the epitome of the patient that we achieve. And I think the reason why we achieve that is because you can see a difference not just in their appearance, but the esteem that they develop after the procedure. They're just, all of a sudden now they're feeling so much better about themselves. They change their hair, they change their makeup, they're wearing different clothing, different jewelry. I think that's the difference that you see when you turn somebody's life around with even a small procedure. Randy, let me show you this particular patient, because I think this is a real good example. When you look at this picture, look at the neck, look at the jowl area, look at the separation and the laxity of the skin on her neck. That's what she came in to talk to me about. But I wasn't finished with that, and I had to talk to her about harmony of the face. So we did more rejuvenation. I know she was bothered mostly by the lower face. When you look at that picture, Randy, you can see the areas that are problematic. She's got the downturn of the mouth. She's got the irregular jawline, which is a contributory factor to the aging changes. She's got that lucis and the laxity of the skin around the nose and around the marionette lines down towards the chin. And all of those things are real negative as far as that aging change. And people want to rejuvenate, and that's what she came to me for.
So this is a typical patient of yours?
Very common patient. She's not very old, but just doesn't like those changes that she's seen, and that makes her unhappy.
Okay, so with her, what do you want to do? Like when you look at her, find out what she wants, what are you thinking?
Well, I'm glad she approached me, and this particular individual, I remember parts of it. She told me, what do you think? This is what bothers me, what do you think? And I'm saying, okay, let me show you. And we hold the mirror up in front of her, and I said, look, for me to get that jowl and the neck and the jawline the way you want it, I'm going to do a little pulling up into the face. I'm going to redrape all that skin. I'm going to do that internal tightening, which I mentioned earlier on the show, and give her that rejuvenated look. And I told her she's going to be happy with that. And we did her eyelids, upper eyelid and lower eyelids as well. So it's sort of a full face rejuvenation.
Let's take a look.
Well, here you go.
Wow.
Now, and again, like I told you before, it's not just the surgical technique that I provided. All of a sudden, she's smiling more. All of a sudden, she's got a different look to her. She's changed her hairstyle. She's changed her makeup. She's changed her clothing. You can't see that part in the picture, but it's there. All of a sudden, her self-esteem has rejuvenated her. And that's what makes the improvement and the change dramatic. And I would mention that she felt so confident with this, someone that normally wouldn't be very confident with her looks. She came on local television with me. So
is that right?
She did, and she was fantastic.
Well, I would say she looks 10 years younger, at least.
Yeah. Well, she tells me 15, but 10 years for sure.
But also, and I'm not trying to compliment you here, right?
Yeah.
I mean, people need to know it's a real interview. But I told you before we started, I said, I could spot a facelift. I'm from California. We could spot even a good facelift. And you couldn't tell she had anything done.
If you only saw the after picture, I like to believe that you wouldn't be able to spot that.
Yeah, no, I don't
facelift.
think so.
But if you see the before and after, it's very dramatic.
But she looks healthy. Easy.
She looks healthy. She looks full. She's got that roundness in her face that I told you before is a youthful appearance. You know what? This is exactly the point. She is the typical patient that comes in, looks tired, and just says, I can't feel confident in that job interview I'm doing. I'm trying to approach it. Look at the eyes. Look at the tired look to her eyes. And here's the after picture, Randy. And you can really see how all of a sudden it's a much brighter look. a refreshed look.
Yeah.
And she's walking into that interview very confident that that's what she's doing. And a lot of our patients are like that. You know, I
So
don't
she
know,
came on TV with you.
she came on television with me.
So her, I mean, is this like a big boost to her self-esteem? I mean, do you
Absolutely.
see the physical changes as far as even the way she acts?
She does, and it's a vote of confidence, not only in the surgical procedure that I do and the things that my staff did in the office, but all of a sudden she is, you know, bright and outgoing and much more confident that she didn't really have, because I see these patients when they come in. You know, a lot of times what I do as a plastic surgeon is also like a psychologist. You know, I'm listening to them, I'm seeing what bothers them, I'm trying to figure out what's going through their mind. And all of a sudden, afterwards, I can see the difference. Look at the eyes before and after. You can really see that brighter-eyed, rejuvenated look, refreshed look, and it looks natural. You know, we didn't have to pull up her eyebrows high to make her look younger. We can just do it
Good
with
point.
a little.
Okay.
We took a little bit of
Because her
skin
brows
away.
are almost the same place, right?
Yeah, well, they haven't moved. I have not done a brow lift on her, but the removal of the little extra skin that was covering her up. And
Like skin above the eyes.
above the eyes, and now she could put that eyeshadow on, and you can see that. Before it was hidden by the eyelids, so now it looks much better.
What's your favorite procedure to do?
Well, I'd have to
I mean, if you
say,
had to-
you know, I know you interviewed my brother, and he talks about the smile. I think the eyes really make a difference, and when people look at someone, the first thing they should do, and what they mostly do, is look at the eyes. So a blepharoplasty is one of my favorite procedures, and I'll tell you why. Not only is it the eyesight to the person, you're really seeing what they're about, but it also is a simple procedure. It's an operation that the stitches come out in 4 or 5 days. They get back to work as soon as the stitches come out. The bruising, especially for women, they can hide with some makeup. So it's a quick turnaround procedure, and it can make a world of difference in the way they look. And as I said, it's the first thing people see.
Because people
So I
are
think it's
working
great.
older now. I mean, you know, people are working into their 70s, 80s, but on a job interview, right? Because you were telling me this even in the green room. Obviously, same woman, but it's obviously one looks more, you know, more energy.
Yeah, more energy, more fresh, more youthful, more, you know, on top of things, you know, more outgoing, just more ready. And if I'm hiring somebody, I might look at that as well.
Yeah, with all things being equal. Look, we're out of time.
Oh.
Final message. Somebody, you know, and I wanted to bring this up because your brother was on the show. He does smile makeovers, right?
Exactly.
And on the Extreme Makeover, that television show, they would. I told him the dentist on that show said that the smile made the biggest difference, even more than the plastic surgery.
Right.
And he said, I agree with that. I said,
Right.
would your brother agree? And he said, no, my brother wouldn't agree.
Well, you know what? I will agree with my brother, and I don't agree with him on everything, but I will agree with him here, because what happens is after we do a dental procedure for rejuvenation or a plastic surgery procedure, the people are smiling more. So what I do also makes them, you know, brighten up their outlook and their look, because they're smiling more, they're more confident, and all of that. And I think that it is the smile that really can make a difference.
Because even if you fix their face, right? Okay, so they have a young face and old teeth. It's part of the harmony, right?
It's a harmony. If they
And
have-
vice versa. If you give them a young teeth and they've got the old face.
Yeah, but if they have the same attitude they had before any procedure, whether it be plastic surgery or dental, we haven't done our job. We need to make them happy and make them feel, you know, much more confident about themselves. And a big smile goes a long way.
Good. Okay, so somebody watching this, maybe they're afraid. They don't want to look done, or they just don't know if they're a candidate. What do you say to them?
Well, you know,
Where's their first move?
Randy, if somebody's not sure about what they see in the mirror, or not sure about what to do, they need to come to see a plastic surgeon. And as a board-certified plastic surgeon with my big team, we can help them with whatever it is. And sometimes they're not sure what they need to do, and we'll help them answer that question.
Okay, good. I want to thank you for coming on the show. Great stuff.
Great to be here,
info.
Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.